Okay, guys, this is the first video in the series of the significance of V02 testing. I have definitely drank the Kool-Aid. I am in love with this test. I have really enjoyed studying it, but I know nothing. So the first part is just how good is this test? How significant is it? So let's just take a quick look at some of the studies. I might be a bit messy here because, they're studies. So I'm going to put myself out of the way. So first video here in this series is going to be V02 peak or max, and part one, review the significance of it. So the first thing we can go to is we have a statement that we put on our website from the American Heart Association, which was put out in 2016. We're going to come back to that statement. We're looking at the resources that we have underneath our website, some of the studies here. We're going to quickly review them, and I'm going to try to move quickly. You can read them more later, but there's some great stuff in here. We're going to come back to the AHA. So this study is actually in our list, mortality trends in the general population, the importance of cardiorespiratory fitness. And I'll just jump down here and read a little bit of this. It's a great study. This was done in 2010, and the American Heart Association statement was 2016. So you got to kind of remember that when you read it. Okay, so we're just going to review this study. This is, again, in our website, mortality trends in the general population, the importance of cardiorespiratory fitness. I'm going to skip some of that. I don't want to drag you through the whole study, but you can definitely read it yourself. So here it says, there is convincing evidence that a moderate or high level of cardiorespiratory fitness reduces the risk of all-cause and cardiovascular disease mortality in both men and women. The protective effect of CRF on mortality is independent of age, ethnicity, adiposity, smoking status, alcohol intake, and health conditions. In the Aerobics Center longitudinal study, compared with the least fit men and women to the most fit men and women, had a 43 and 53% lower risk for all-cause mortality, and a 47 and 70% lower risk of cardiovascular disease mortality, respectively. So one of the things that you find out when they test for medications, from what I understand, if a medication has a 5% improvement, it might be deemed a relevant medication. Here, we're not talking about 5-10%. We're talking 43 to 53% or 47 to 70% improvement in changes that have to do with cardiorespiratory fitness. And of course, this study goes on to argue that the American Heart Association and others maybe need to elevate the importance of testing cardiovascular fitness. In fact, this whole study is about trying to do that. So let's just read this little part towards the bottom, the conclusion. I think there was an earlier part that I wanted to make sure, see if I have it here. Nope. So we're going to go here. Sorry for all the movement. Moderate to high levels of cardiorespiratory fitness and improvement in CRF are associated with lower risk of mortality for all causes and CVD in both men and women regardless of age, smoking status, body composition, and other risk factors. Methods of CRF assessment and study design. CRF appears to attenuate the higher risk of death associated with obesity, although it is not yet clear whether CRF completely eliminates mortality risk in obese individuals. We believe that including CRF in clinical examinations along with the traditional evaluations such as blood pressure measurement and blood chemistry analysis may contribute to chronic disease prevention and longer lifespan. And there were some other things that they had mentioned in this study about how they felt like that overall doctors have not given the measurement of CRF proper weight. And so this was 2010. And then if we look, we find out that in 2016 The American Heart Association puts out this statement. Mountain evidence, oops, sorry. Let me make that bigger so we don't have to. Mountain evidence has firmly established that low levels of cardiorespiratory fitness are associated with a high risk of cardiovascular disease, all-cause mortality, and mortality rates attributed to various cancers. A growing body of epistemological and clinical evidence demonstrates not only that cardiorespiratory fitness is a potentially stronger predictor of mortality than established risk factors such as smoking, hypertension, high cholesterol, type 2 diabetes, but that the addition of cardiorespiratory fitness to traditional risk factors significantly improves the reclassification of risk for adverse outcomes. The purpose of this statement is to review the current knowledge related to the association between cardiorespiratory fitness and health outcomes, increasing awareness of the added value of CRF to improve risk prediction and suggest future directions in research. Although the statement is not intended to be a comprehensive review, critical references that address important advances in the field are highlighted. The underlying premise of this statement is that the addition of CRF for risk classification presents health professionals with a unique opportunities to improve patient management and to encourage lifestyle-based strategies designed to reduce cardiovascular disease. So it goes on, and it's a continued long argument about why they believe that it should be added to the clinical signs for managing disease and health. And then they have a nice one right here, which I want to take a look at, which is kind of a review